Welcome back to Bloomberg News. President Obama says passing health care legislation this year is, in his words, make or break. With the House and Senate presenting varying proposals, how likely is it that a bill is passed and then signed into law? Let's talk to someone who's familiar with prior reform efforts, former Medicare Administrator Gale Wilenski, an economist who is now a senior fellow at Project Hope, an international health care education foundation. She joins us from Washington. Ms. Wilenski, welcome to Bloomberg News.
Very nice to be here. Thank you, Mark.
Ma'am, have the battle lines been drawn already? Is this going to be politicked to death, or is something going to get done this time around?
More likely that something's going to be done. There are a lot of lessons that have been learned from the 1990s. We are just beginning to see battle lines drawn. The more specific the plan details become, the greater the potential for warring factions to emerge.
Ms. Wilenski, what were those lessons that were learned? What needs to be done this time around, and what needs to be avoided?
Too much specification from the administration. The last time, you'll remember the 1,357 pages of legislation that came from the Clinton administration down to the Congress. A lot of offense was taken. Congress gets to write new legislation. That mistake has clearly not been made. The biggest challenge right now for the Congress is going to be how they fund, how they pay for the program that they propose. We haven't seen exactly what they're going to propose, each of the three relevant committees, or what will come out as a combined program. But there is growing sentiment that there can't be another program that isn't funded. We've seen two large programs costing about $1.5 trillion passed in the last 6 or 8 months that were not funded. The question is, how does this new health care program get funded?
And the opponents of this say that basically it's going to break the bank. How can you fund health care reform overhaul without increasing the deficit?
Well, you can find revenue to pay for it, and there are a lot of ideas that are being raised. Whether or not it's possible to get some money out of the Medicare and Medicaid programs. Whether or not there should be taxes on sugary beverages because they lead to obesity, whether to consider putting some limits to the amount that people can get tax-free in terms of employer-sponsored health insurance. These aren't really new ideas, but they are being considered with great seriousness.
Right.
We haven't seen how much coverage and how fast that expansion is going to be proposed either in the House or the Senate. That will largely determine how much money they have to come up with and how quickly.
Right.
Then we'll need to see what the Congressional Budget Office says can be saved or can be raised in terms of new revenue.
Ms. Wilenski, will the president be able to use the bully pulpit to get the insurers and the drug companies on board?
It looks like, at least to date, the insurance companies and the drug companies have said they want to play. They met with the president. They pledged to find large amounts of savings. There seems a willingness to have insurance reform where everybody can buy insurance, even if they've had pre-existing medical conditions. I think the insurance companies recognize that part of the rules going forward are going to be having to make sure that people can get insurance and not be discriminated against.
Yep.
They want, on the other hand, that everybody is covered because they're worried that only people who expect to use health care would join. Otherwise, it's going to be a lot of trade-offs, quid pro quo.
Ms. Wilenski, what type of public plan do you feel would work best?
Well, that's probably the second most contentious issue after how you pay for the expansions. Do you need a public plan at all? And if so, what kind of a public plan? Republicans and some conservative Democrats are a little nervous that a public plan could become the dominant plan.
Right.
They're not sure they want that. Many Democrats feel you have to have a public plan. And so the question might become, as a compromise, is it a public plan as a fallback? That's
Right.
what we did in Medicare, where it's only if there weren't any plans available, there would be a government plan. Or is it going to be a public plan like Medicare, where government sets prices
Right.
in order to try to keep spending down, although, as we know in Medicare, Medicare spending is unsustainable with
Right.
lots of promises made we haven't covered.
Ms. Wilenski, I have a lot more questions, but unfortunately we're out of time. Hopefully we can have you back. Gale Wilenski, former Medicare administrator, now senior fellow at Project Hope.